If someone notices a growth on their body, the first thing they need to do is go to Chattanooga Skin and Cancer Clinic.
Appointments available now. Chattanooga, Cleveland, and Jasper.
If you know someone, perhaps you yourself are, dealing with neuropathy issues, pain associated with that, you know how problematic it can be, how much you wish that you could make the situation get better, if not go away entirely. Shawn Jones hears that a lot. He has Chattanooga Wellness, and he's back in the studio with us
this morning. It is great to be in the studio again.
Good
Thanks for having us, Julie.
Good to see you back in the studio. So I might have botched that a little bit, but I think that this is true, that if you can get your diabetes in check, then the neuropathy kind of can ease up a little bit. But you like to try to help people in tandem to get that neuropathy pain.
Yeah, it's a lot more than just
quickly.
getting the sugar. We have a new machine. It's called shockwave therapy. Now, it's a $50,000 machine, and we actually have the only territory for Chattanooga. And it's the only machine that is FDA approved to treat above the ankles. So any machine can do feet and ankle. But if you want to get your knee, your hip, your shoulder pain, arthritis, stenosis, all these different things treated, you got to use an FDA-approved machine, and that's what we have. We have the only one in Chattanooga.
Okay, so what is it exactly? Because looking at that image,
it's pretty amazing, yeah.
That looks like the laser that you've
That's
shown.
the laser there. The machine right before that picture, that right here, that's a shockwave. I'm working on my lovely wife's knee right there. She was scheduled for knee replacements, actually, or they wanted, Dr. Ballard's a great doctor, and he wants to do a knee replacement on her. Well, she's only 46 years old. And we don't want to do that for another 15, 20 years. So we're using the shockwave and K-laser therapy in tandem together, and she's getting results with it.
Okay.
Which is pretty amazing.
Now that would not be a neuropathy issue though. That's something entirely different.
Here's the cool thing about shockwave. We can do shockwave on any tissues in the body, any joint in the body below the mid-neck. We can do elbows, shoulders. If you have knee pain, that shockwave goes in. What it does, this is the beautiful thing, it tears the tissue down on a micro level. So shockwave is going to tear the joint, the adhesions, the fibrosis, and all these tissue complications from injuries that have mounted up over the years, and it tears it down and lets it rebuild. So then your stem cells and your fibrin can come and lay down new, more elastic tissue in your joints. And so to get the results, every time we do a treatment, it takes 21 days to see the full effect of each shockwave treatment that we do.
Okay, so for the average person listening, and I'll raise my hand there, to hear that you're going to use this shockwave that's going to tear apart the tissue, that sounds like a negative. But then you follow it up with the keywords, then that lets it rebuild the correct way.
Just like when you buy all these builders are buying houses that are crappy little houses, they're tearing them down and rebuilding. That's what we do with your joints. We tear down the bad tissue, the adhesions and the things that are stopping you from functioning, that's causing all the pain and suffering. We tear it down with the shockwave therapy, and it rips it down on a micro level, not a big tear, micro levels, and that immediately stimulates the body to come in and start healing it.
Well, does that cause a little bit of pain as an interim, Shawn?
No, not. You can feel it. It's energy coming to your body. It's sound waves. So it's not shocks. It's not electricity. It's sound waves coming into your body like this. And so what it does, it stimulates your body to heal. Now, what we do, and you saw the picture of the laser, is as soon as we treat a joint, we also include for free the K-laser treatment. So we do the laser on you.
And what is that going to do?
Well, laser does 4 things. It decreases pain, decreases swelling, increases blood flow, and it super heals tissues much, much faster, as we talked about many times.
Okay.
So what we do is we go in and we tear down the tissue with the shockwave, and we go right back in and we rebuild the tissue with the laser. We start right away with the laser. Or we also have regenerative medicine at our office, stem cell therapy, people call it sometimes. And we do that. We'll tear down the tissue, whatever joint you want down, your shoulder, your knee, your back.
Right. And
we'll tear down on a micro level the adhesions in those areas right before we do the injections, which is beautiful because you get better results.
I think you said something about 21 days. When you do the shockwave, then it can take up to 21 days. Is
Correct.
That right?
Yeah, to see the full effect of each treatment. So if we did a treatment once a week or twice a week, each treatment you're going to see the maximum effect in about 21 days after each treatment like that.
So that was going to be my question then. Do you wait 3 weeks in between?
No, not usually. Most people come once or twice a week. Now, in our neuropathy program, we include 3 shockwave treatments as people are going through a 2 to 3 month program with us to heal their neuropathy. We have a 98% success rate on that. Now it's even higher because of using shockwave to tear it down first.
Okay, and I think I misspoke on the neuropathy side of things too, because neuropathy in and of itself, is it painful or is it not?
Yeah, neuropathy has burning, tingling, pain, numbness, balance issues. That's the problem. Is you start losing your balance, you fall down and you break bones or damage joints, and that's where it just gets really, really bad.
Okay.
So we work with balance. We work with healing the tissues, decreasing the pain and the inflammation of neuropathy. And that's why we tear it down on the micro level, the adhesions in your feet and in the low back. Remember, with neuropathy, you have to treat where the nerves originate and where they terminate. That's why, like, podiatrists can't treat the back. They can only treat the feet. We can go in there and treat the back and the feet with the beginning of the nerve and when the nerve terminates. And that way we get tremendous results by working on both.
So do people ever come to you and say, I think this is going to work for me, but I'm a little bit cautious. If you've got neuropathy in different places, can they try it in one area to see if they get a result?
Oh yeah, absolutely. And it's not just neuropathy. If you're having knee pain, you're contemplating knee replacements like my wife, we can go in and do just shockwave by itself. In fact, we have a testimonial from a lady that has stenosis and neuropathy, and I forgot she had neuropathy because she's been a patient for 30 years. And I treated her low back, and she came in and said, oh my gosh, I haven't had any pain in my feet for 2 weeks. So it's not her diabetes causing the neuropathy. It is actually the stenosis where the back closes in on the spinal cord. And that's fascinating. So we're taking care of her right now, and her testimonial is on there, how much better she did.
So when people come to you, like in this lady's case, if she has this stenosis in her spine, then I would imagine she's got a physician who's kind of attending to that for her. Do y'all work in tandem?
Well, 20 years ago, because then they said there's nothing else we can do. That's the thing. With stenosis, you either cut the spine and take it out, call the laminectomy, where they take it out, or you just live with it. And that's it, and then they don't treat anything else. So we can go in there, and that was fascinating to me because I wanted to see how it worked on stenosis, and I was like, wow, it really does work. It really does help people that have no hope, these joints. And if you're going to schedule for a joint replacement and you want to try something to avoid that, there's nothing wrong with doing a joint replacement if it's bad enough. But we can go in there and change it and turn it around.
Do these things result sometimes from injuries too, Shawn?
Always. It's a repetitive injury use can do it. You can do it from major trauma, like my wife had before I ever knew her, had a car engine come into her kneecaps and really tore up her knees bad. And the right one is worse than the left. So we're working with that. We also did some regenerative medicine in that knee just last week also.
So that if it's a long ago injury, it doesn't mean that you have to accept it now with new technology and approaches.
Exactly. In fact, to me, it seems like the shockwave works better with chronic old things. Now, we can do acute bursitis. We had a couple of people come in with hip bursitis, and in 6 visits, they're doing great. Now, we did the shockwave and followed up with laser right afterwards. And you can tell I get excited about this because this is the latest technology out there, and it's safe. There's no side effects. There's no downtime. It's affordable. And the first thing we do is we take a history when you come in. Maybe you don't need shockwave, or maybe you need shockwave alone and nothing else. Maybe you need laser treatments. Maybe you need the full neuropathy program. Maybe we have to send you back for a joint replacement. It's just too far gone. I mean, I'll tell you that and be honest with you about it when you come into Chattanooga Wellness Centers in Cleveland and Chattanooga.
I was about to say that he's got 2 different locations. So there's the office there in Cleveland, the one here in Chattanooga. The best web address for you to go to for this particular topic is shockwavepain.com.
Yes, ma'am.
But you can learn more about all that they have to offer by going to
our YouTube channel or to the Shockwave, and you can go from there to the neuropathy page or laserwavepain.com. These are all in the same website right there.
Always good to see you, Shawn. The Chattanooga phone number 643-2277. If you're up in Cleveland, that number 790-5000. Back after this.
Great to see you, Julie.
Our homes are often our largest investment, and over the last 6 years, my team has helped over